everyone to the On with Amanda Medicare podcast. This is our first episode. We're going to be talking about Medicare basics, starting right at the beginning. Before I jump into the good information and the agenda that we're going to cover today, I do want to say thank you to all my clients. The last 10 years helping you has taught me what I'm about to share and has really put together the content for this podcast. So without you, it wouldn't happen. I appreciate you. So again, today we're going to talk about Medicare basics. We're going to talk about what it is. We're going to talk about when you can have it. We're going to have a conversation about whether or not you even need to do Medicare or have Medicare when you're eligible for it. And we're going to talk about how to get enrolled if you need to. We're also going to cover a little bit about Medicare Part A and Part B, what it costs, what it covers. And then we'll finish up talking about what to expect in the next episode. I'm going to jump right in. Medicare is a federal health insurance program. It is part of the legislation that Lyndon Johnson signed into law, the Social Security Act of 1965, and it provides health insurance coverage for individuals 65 and over. You also could be eligible for Medicare prior to your 65th birthday if you were to have Social Security disability payments for 24 months. You'd be automatically enrolled in Medicare starting that 25th month. Also, sometimes there are qualifying conditions such as ALS, end-stage renal disease that would bring Medicare into your health insurance options prior to reaching that 65th birthday. The when is a very important question. I know that there's conversation out there about late enrollment penalties and, oh, what if I don't do something on time? So let's clear that up right away. When you're approaching your 65th birthday, you have a 7-month window, which Medicare calls your IEP, or your initial election period. So consider the month that you turn 65 to be your 0 month. You have 3 months before that you could let Medicare know that you want Part A and Part B and explore other programs that go along with Medicare, which we're going to cover in detail. You also have 3 months after the month that you turn 65 to enroll in Medicare Part A and Part B. There's some important things to keep in mind though, if you do choose to wait until the 3 months after, because not everything will start exactly when you think it will. So we're going to talk about that. So before we jump into how to enroll in Medicare and when, I do want to have a quick conversation about whether or not you even have to. I do get a lot of calls from people saying, Amanda, wait, I'm still working. I'm insuring myself through my work. I'm insuring my spouse. Maybe I'm insuring children still. Why do I even have to do this Medicare thing? And it's a very valid question. The answer comes down to Medicare's coordination of benefit rules. So I want to be very clear about this. With Medicare and coordination of benefits, meaning you have other health insurance options, Medicare is going to ask you two important questions. The first one is, are you offered that group health insurance coverage through your current employment or as a retiree? So actively employed is a key factor. The other thing is the size of the group that you are a part of. So with Medicare coverage and coordination of benefit rules, Medicare says if the group size that you belong to is under 20 employees, then Medicare would be primary coverage and they're going to require you to have Medicare Part A and Part B. If that coverage that you have is large group, meaning 20 or more employees, then Medicare would become secondary to whatever group insurance plan you're insured with. And then you would just want to do an analysis to find out, I have group coverage, but which would be better for me? So do I have to? Am I actively employed in a large group? If the answer to those is yes, the next question would be, should I? Let's compare the coverage details. Again, if you're not actively employed and you don't have coverage through large group, then you would have to do Medicare, or your group benefits will actually reduce the amount that they pay by what they would expect Medicare to contribute to those costs. So coordination of benefits is an important thing. Large group, small group, retired or actively employed. The next question is when. So I mentioned we have that 7-month initial election period that sort of spans your 65th birth month. What will happen 3 months before the month that you turn 65 is that initial election period will start, and you'll have 3 months to enroll in Part A and Part B, explore other programs like Part D, Medicare Advantage, Medicare Supplement. If you wait until after 3 months, your Part B is going to delay to the first day of the coming month. So once you know whether Medicare is required based on your group insurance coverage details, the how is the next question. How do I even get enrolled in Medicare Part A and Part B? For some people, you'll be surprised and pleased to know that you may not have to do anything at all. So if you are within 5 months or 6 months of turning 65 and you are already collecting Social Security retirement benefits, then you'll automatically be enrolled into Medicare Part A and Part B. You don't have to do anything. Your card will magically show up in the mailbox right about the end of the 4th month before you turn 65. If you aren't collecting Social Security, then we would have to take steps to let Medicare know that, yes, I do want to and do need to be enrolled in Medicare Part A and Part B. There's 3 ways to accomplish that. So the 3 ways to accomplish enrollment into Medicare would be online through your online Social Security account at ssa.gov. That is the easiest way. And in fact, once you enter that 3 months before that initial election period, if you were to log in and scroll down from where you see information about your Social Security income, if you collect now, if you wait, etc., if you scroll down, you'll see a link, simple link towards the bottom. If you scroll down, that says start a Medicare application. Now, entering into that application, Social Security, Medicare, knows that you're asking for Part A. They're going to specifically ask you about Medicare Part B. And depending on the answers to those questions we discussed before, you'd know if you're going to say yes or no to that. So I've already said Medicare Part A a couple of times. I know that when people talk about Medicare, they talk about all the programs. So Original Medicare, Medicare Supplements, Medicare Part D, Medicare Advantage. And while most of those things are affiliated with Medicare, I really do want to be clear that actual Medicare or traditional Medicare, sometimes called red, white, and blue Medicare, the actual coverage that's provided through this federal program is strictly Medicare Part A and Part B. I want to talk about what those letters mean and what Medicare A and B covers, and I have a helpful graphic to help us with that. This is an exercise that I do in person with all my clients or potential clients because it's important to me that they really have a solid understanding of the foundation of Medicare, which is Part A and Part B, but I do want to get into the details of that. So Original Medicare is 2 pieces of coverage. Part A they call hospital, Part B they call medical. I tell clients to think of Part A, hospital, as your inpatient coverage, because Medicare Part A is the piece of Medicare that's going to help cover the costs associated with being admitted as an inpatient to a hospital facility. It also would help with the cost of an inpatient short-term rehabilitation stay at a skilled nursing facility with some qualifying criteria. I will state that Medicare Part A also does cover hospice services. That's a different scenario. For most people, Medicare Part A is going to cover their inpatient, so inpatient hospital or inpatient skilled rehab. Medicare Part B is all of your outpatient coverage, so they call it medical. I would say Medicare Part B covers services such as physician services, both primary and specialist appointments, helps cover things like lab work, diagnostic, imaging, so x-rays, MRIs, CT scans, helps with ambulance services, physical therapy, urgent care, emergency room, one-day surgery procedures. Part B is also the part of Medicare that helps cover medications that you receive in the doctor's office. So things like some vaccinations, infusion type therapies, maybe for rheumatology, for chemotherapy, maybe a Prolia injection for bone density. Those are actually Part B covered medical benefits. Sometimes people think that goes through drug coverage, but it doesn't. So Part B is really everything outside of being admitted as an inpatient. So let's talk about the costs associated with Medicare Part A and Part B. Medicare Part A is typically a 0 premium program. What I mean by that is as long as somebody or their spouse is fully insured for Social Security benefits, which is that 10 years or 40 quarters of work history, you've paid into the Medicare program through your payroll taxes. So once you start receiving Medicare Part A benefits, there's typically no charge for that. There would be a cost for folks who haven't accumulated that work history. Not super common. So most people would enjoy 0 premium Part A. Medicare Part B does have a monthly premium. This year, they set the standard premium at $185 a month. For folks who are collecting that monthly Social Security benefit, you'll see that they would take that $185 out of your Social Security check the month before your Medicare starts. If you aren't collecting Social Security, obviously they don't have that monthly benefit check that they can pull that premium from. So what would happen is you would be receiving a bill in the mail. So Medicare will actually send you a Part B premium bill. They do that on quarterly increments. So if you were starting Medicare January 1st, I would expect by mid to late December, you would receive a bill for January, February, and March premiums, and you would remit that payment to Medicare. I do encourage clients to consider if they plan to delay Social Security benefits for a while. There is a form where you can request auto deduction right out of a bank account. It does take a few cycles for that to get set up. So if you're only going to delay Social Security for a few months, then I would say just pay by check. But if it's something that you're planning to delay for a year or more, you do have an option to set up an auto deduction for your $185 per month premium. Now, some people pay more and some people pay less for Medicare. So there is something called IRMA, or Income Related Monthly Adjustment Amount. One of my future podcasts is going to talk more about Medicare Part B premium costs. So who's IRMA? How do I get away from her? Is there anything that I can do? How do they base that? And also about the cost savings program. There is a program called the Medicare Savings Program. It has different levels based on income, but those programs help with some of these Medicare costs. So that's a whole podcast in itself. It's a lot of information, but for most people, there's a standard monthly premium of $185, either deducted from Social Security or billed quarterly, with some considerations based on income. Next, I want to talk about what Medicare covers. So we know what it costs, but what does it cover? Medicare A and B work independently of each other. They each have their own deductible. So I'm going to go through those now. These numbers change a little bit from year to year. So see a little bit of increase, never anything substantial. It's not like 1 month, 1 year it would increase by hundreds and hundreds of dollars. So for 2025, the deductible that Medicare would ask you to pay when you're admitted to the hospital is $1,676. That $1,676 would be due anytime you're admitted to the hospital with a return to the hospital window of 60 days, which we can talk about. So that is not an annual deductible. It is a per event deductible. But that $1,676 actually covers 60 full days of inpatient coverage. What I mean by that, if you're in the hospital for 1 or 2 days, or you're in the hospital for 60 days, the total amount Medicare is going to ask you to contribute is that $1,676. They're going to cover the rest, which is the vast majority, so that's good. Some people don't realize that Medicare does have copays or coinsurances that start on day 61. Now, before I show you these numbers, because sometimes people get a little bit nervous about them, I do want to say 2 things. First is that we're just talking about the foundational Medicare A and B. We haven't yet explored or discussed the ways that we can address these costs. But if somebody did have Medicare Part A only and they were in the hospital longer than 60 days, they would start to incur per day copays. So this would be without adding anything. So don't be too nervous. The second thing I would say about the cost I'm about to share with you is that I think it's safe to say that it's uncommon for someone to experience a 60-day hospital duration. I do think that hospital stays tend to be shorter in duration than 60 days. So it's not very common that people reach that day 61 of a continuous stay. But in the event that you did, Medicare would ask you to start contributing $419 for each day that you're there starting on day 61, unless you happen to get to day 91. So now you've been in the hospital for 3 full months. Quite uncommon. Again, anything we add to it is going to help with this, but just as Part A stands on its own, starting on day 91, they would increase that cost to $838 a day. I know that those numbers can be uncomfortable. I would just say, remember, we are going to talk about how to address them. In the beginning, I talked about how Medicare covers inpatient hospital. So this is the cost that you'd experience for a short-term, either 1 to 60-day hospital stay, and what you'd start to incur if you were there longer. I also mentioned that Medicare covers skilled nursing or rehab services. I think when they say skilled nursing, I think it's misleading. Medicare is never going to do a good job of covering any long-term custodial type care. Medicare's coverage for services inside of a skilled nursing facility or inpatient rehab are strictly rehabilitative in nature. They want to see that you're participating with physical therapy, that you're showing some improvement in the condition that occurred to land you into the skilled nursing facility. And they qualify that by requiring a 3-day hospital admittance, or Medicare won't cover anything for rehab. So it is important to know, way back in 1965, the legislation said, yep, you have to be in the hospital for 3 days. And then if you go for rehab, we will participate with those costs for a short period of time. What's kind of nice is that Medicare does cover 20 full days of inpatient coverage with no cost. So just about 3 weeks, right? You can be a physical therapy all-star, hopefully get strength back and get to the point where you were before you had that inpatient hospital stay. And those first 20 days wouldn't cost you anything. Medicare Part A will continue to help with the cost of skilled nursing from days 21 through 100. With a per day copay of, we'll call it $210, it's $209.50, about $210 a day that they would ask you to contribute. 100 days is the maximum number of days per event that Medicare Part A will help with any rehabilitative or skilled nursing facility costs. And in the real world, what I see is typically around day 20, Medicare will start to ask for those progress reports from your care team. Is this continuing to be a rehabilitative stay, or do they consider it to be plateaued and chronic, in which case they would, let you know how much longer they would cover, but they would start to cut off that coverage. So that's the Medicare Part A. I already unveiled the Part B, but let's go back and talk about it. So Medicare Part B in a lot of ways is a bit simpler. Medicare Part B, again, just as a reminder, are things like your doctor services, lab work, diagnostic, imaging, physical therapy, ambulance, everything outpatient. Every year Medicare sets a deductible. They do reset in January. So if I'm sitting down with someone who's, turning 65 in November or December, we kind of have to figure out, you only have a month or two, and then that deductible is going to reset again. So even if you start Medicare during the year, these deductibles all reset for January 1st. This year they set the deductible at $257. So anything that's not preventive and wellness, and if you were to go to Medicare.gov and Google preventive services, you're going to see a list of all the things that Medicare Part B covers as preventive. Things like bone density, breast cancer screenings, other cancer screenings, annual wellness visits, and the frequency with which they'll cover those. Those services, because they're preventive and wellness, are not subject to the deductible. But anything other than that, if you went in for a sick visit with your primary care doctor or whatever, they would bill Medicare and they'd say, oh, we haven't met the deductible yet, so this $257 is what would be due from that appointment. So $257 for the year. Once you've met that deductible, Medicare is going to start to cover 80% of all of the health care costs that you incur. You would be responsible for a 20% coinsurance. Most people are familiar with the 80-20 number, so hopefully that doesn't sound too unfamiliar to you. A couple of things I like to mention. The first is that 20%, it's kind of an undefined number. That 20% in dollars and what it equates to in dollars and cents is going to be dependent on what Medicare's negotiated rate is for that particular service. So if you ever looked at a doctor bill or a medical bill, you usually see an amount, like a charged amount, and then an adjustment, which is usually less than what was charged. Medicare has that same exact thing. So it's not 20% of those kind of bigger, scary numbers. It is 20% of what Medicare allows for those specific services. But I will say, unfortunately, Medicare on its own doesn't put a cap or max out of pocket on what your cost can accumulate in the year. And that unlimited 20% or however many hospital stays you incur, I think that's a good reason to consider something else with your insurance. So in upcoming episodes, what we're going to talk about is, how do we address this? How do we have additional insurance in place that will give us a cap on what we could spend in the year, that will help me with these deductibles and co-pays. And also, you may notice that I deliberately haven't said anything about Medicare Part D. People are surprised to know that actual Medicare, being just Part A and Part B, this coverage that we're talking about now, doesn't provide any prescription drug coverage. That's all private insurance through the Part D program, which started in 2006. So we're going to talk about the ins and outs of Part D. We're going to talk about Medicare Supplement, Medigap plans, and we're going to talk about Medicare Advantage and how those programs work with Medicare, or maybe how they don't, so that you have a really good understanding of what types of costs you'd see out of pocket with those programs. So we're at the end of our first episode. I hope you found it informative and helpful. Just a reminder, we went over the what, the how to enroll in Medicare if you need to, do you need to, and we talked about Part A and Part B, that traditional Medicare foundational component. I also am pleased to announce that in our next episode, we're going to have a special guest. Her name is Haley. She works for a company called Advanced Diabetic Solutions, and she spends all day, every day, helping Medicare beneficiaries obtain the diabetic supplies that they need. She's been a tremendous help for my clients, so I'm excited to introduce her to you. Thank you again for listening. Again, like and subscribe, and thanks for joining me today. Thanks for listening to another episode of the I'm with Amanda Medicare podcast. Please make sure to subscribe wherever you get your podcast so you don't miss an episode. Also, please leave a review, as that helps me reach more people that can benefit from this podcast's content. If you have questions or topics you want me to cover for a future episode, please email them to info@imwithamanda.com. I look forward to hearing from you. Like any good industry, we do have compliance requirements, so here's my disclosure. We are not a government agency. We are licensed insurance agents who discuss insurance programs such as Medicare Advantage, Medicare Supplements, and Medicare Part D prescription drug coverage. Any specific plan information I provide is limited to the plans I offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Thank you.